Hi, I'm Rashmi Raju, and I'll be doing a presentation for the first milestone. And the research project is about simulation-based medical device tutoring systems. For this first milestone, we're just going to look at the research project's work established so far, go through brief motivation and goals that we want to accomplish, and the supporting methodologies and data collection plans that we have. Any feedback provided from peers would be greatly appreciated. Thank you. So the research question that we're trying to answer here or explore here would be to understand how can we enhance simulation-based medical device tutoring methods in order to improve medical professionals' expertise with clinical devices. As you may know, medical devices are becoming more and more complex, and they require the user, the medical professional in this case, to be able to operate, proficiently and also learn how to operate them in a short amount of time. Moreover, the medical professional should be able to use these devices accurately and proficiently in critical real-life scenarios. And these medical professionals, can range from doctors, physicians, nurses, residency students, paramedics, and any healthcare professional that need to use medical devices as part of their regular job responsibility. And we want to be able to look at how simulation-based tutoring can be applied to improve the methods that are currently used for medical device training. So the motivation for this research project is basically to support the training experience in terms of giving, providing a way for medical professionals to have a encapsulating view of real-life experiences during their training itself. And then this over time will build their ability to react effectively in medical scenarios. And these real-life experiences can, range anywhere from being in the emergency room, being in ICU, or being in a clinical setting where you're dealing with a patient with a very critical health condition. Regardless, in these situations, healthcare professionals are required to know how to use their devices effectively and accurately. And in order to ensure that, we want to make sure that their training in advance is robust enough to support them in their actual job setting. So there are existing solutions that currently use simulation-based learning. The first one is actually a patent put into place that talks about using a computer unit with display and supporting hardware that will remotely get updated, and it allows the student to engage in a self-learning and convenient and interactive way. And this apparatus is meant for basic medical device and basic medical concepts learning, and it basically goes through how all these different parts can work together in order to have this very effective medical device training tool. SimCore is a simulation-based unit which actually uses intelligent tutoring systems for learning about surgical procedural knowledge. And there's a lot of variety of scenarios that are built into this SimCore that guides the students during performing a medical procedure, and it also assesses their reactions and capability to effectively assist patients. But this one is targeted, solely for surgical procedures. There are also cognitive simulators in which we assess how medical professionals engage in multiple tasks and how their load is distributed, cognitive load is distributed among multiple tasks. So these solutions really show that simulation-based learning is used currently and is something that it has proven to be effective. In our research project, we want to look into how we can provide a comprehensive view of using medical devices, and not so much with surgical procedures. So, research methods and data. So here, this is just sort of like an overview slide of the research methods that we consider in our project and the data methods that support each of these research methods. So on the left, we have communities of practice and problem-based learning, which are supported by surveys and interviews, data collection. Case study research, which will be supported by empirical data collection of performance, proficiency, and retainability, analysis of different simulation-based learning tutors. The design-based research will be supported by assessing different curriculum methods and their level of usability with respect to learning about medical devices. So survey and interview, the motives for survey and interview. We started with survey in this case in this project because we really want to understand how what is the need for enhanced training in healthcare with respect to medical device operation, and this is targeting the general public who receive the care from a healthcare provider. Interviews will be targeting the medical professionals, and in order to understand their experiences with learning how to operate devices and actually operating the device in a real-life scenario. Communities of practice plays a role here because we are looking into how the student is able to learn from their environment and situations and contribute to their surroundings at the same time. One way that students can learn from surroundings is definitely by having experts around them. Of course, practice is also one way, but having the experts contribute to their real-life experience really enhances their learning opportunity. Problem-based learning is applied in our project because it looks at the unique experiences that students have in order to increment their knowledge accumulated over time, and different type of professionals have different type of experiences, and this problem-based learning concept it targets that self-instruction based on unique experiences, which will be crucial for our simulations. We'll just go over the survey results gathered from the initial survey we gave out to the general public. We surveyed about 78 people regarding their general experience with healthcare professionals when they're using medical devices on them. So the first question was, how comfortable are you in general with a healthcare professional using a medical device that you physically come in contact with? So here you can see that out of the 78 people, there were 21 people who reported that they were somewhat comfortable or not comfortable at all with the way that a healthcare professional would use the medical device on them. A similar question, how comfortable is a patient with a medical professional using a device for their health screening but not in contact with? Here you see that the distribution goes a little more comfortable because they're not directly coming in physical contact with the device, so that could have somewhat to do with the fact that the risks involved to affecting their health is lowered in this case. The next question is just to gauge, how how often people usually do visit the doctor and come in contact with professionals. So the majority of the population that we surveyed, it ranged anywhere between 1 to 5 times. And some people had gone to the doctor at least, 10 times or more than 10 times. So this question is more of a feedback related question. So this question gauges if the patients have visibly noticed any lack of experience or precision using a device. And this is actually pretty alarming because you see that more than 50% of the people we surveyed actually noticed some sort of lack of precision or expertise in medical professionals using a device, which is not necessarily something we would want, because out of any of that 1 to 29% that they notice a lack of precision, there could be an incorrect usage that could lead to risks in their healthcare. So that is something that does strike as an important feedback from this question. The next question is, what percentage of the time have you experienced discomfort in the way a professional uses the device? And here too, we acknowledge that majority of the people experience discomfort in some way or the other. Only 25% said that they did not, but the remaining number of people did. More than 25% actually ranged between the 10 to 29% of time where they experienced discomfort. So there is some level of carelessness that is reflected in medical device usage that is actually affecting the patient and the comfort level they experience. So the next question is asking if patient has ever experienced discomfort in directly interacting with a particular medical device. What this means is when they're in the environment or in the position of having that direct interaction with the medical device, if they've ever felt uncomfortable in that instance. And more than 50% said that at least once they have felt this discomfort. So having to, make motions with their body in order to help that interaction with the device deemed uncomfortable for them. The next question is, have you ever noticed inconsistencies among different medical professionals in the way they use common devices? So here, most of the people said sometimes they do see this inconsistency, and the reason that we would want to maintain consistency is because then it makes it easily transferable, in terms of the skills in the medical professional's point of view, and then for the patient's point of view, it makes it easier for them to feel comfortable and feel that their care is given the utmost quality, and they don't have to experience any sort of confusion when they're under the care of a medical professional. And the last question here is, have you ever avoided or changed certain doctors or clinics because you felt a lack of experience from the staff in the way they operated medical devices? So here, majority of the people said they never had to do this, but there are a significant amount of people that said they did have to change doctors or the provider because of experiencing some sort of lack of experience. And there are a good amount of people, more than 25% of people, that said 2 or more times they had to do this in the past, which means that the inconsistencies or the lack of expertise could have definitely contributed to this sort of decision or feedback from the patients. We have not gathered the data for the interviews yet, but this is the interview plan that we have set in place. The interviews will be in-depth interviews of 5 medical professionals. 2 of them will be nurses, 1 internal medicine resident student, 1 paramedic, and 1 physician's assistant. The goals of the interview will be to gather the list of information we have here. We want to be able to gather information about difficulty in learning new devices generally. So any sort of devices that these professionals have to learn, what is a sort of rating of difficulty they experience. And since we have a variety of different medical professionals listed, the results will vary across them. The next goal is have them describe 1 or 2 experiences where it was difficult to learn a particular device and what kind of outcome resulted from learning that device. Resources that help most to learn a new device, so kind of cross-reference everyone's feedback about the resources that they use to help them learn about a medical device, their experience of using the device on patients, the time it takes them to learn the new device, recovery methods used when the device execution goes wrong in practice and also in actual real-life scenarios, thoughts about simulation-based training devices and any current simulation training devices that they use in their job. Also, last but not least, suggestions that are overlooked in existing simulation-based training devices that they feel that would really benefit their job responsibilities and give them even better training in advance to being present with the patient and having to treat the patient. So, simulation-based tutoring system. What this is basically showing here is indicating how intelligent tutoring system is going to form the backbone for simulation-based learning. And this collaborative effort, we can basically think of using ITS as the representation of an interactive device between the trainee and multiple levels of trainers that are represented in the simulations, represented through the simulations. And the simulations will be based off of virtual representations. These virtual representations could be videos that illustrate reality of the environment surrounding the professional, and also agent-based representations in which we want to maintain detail-oriented nature of the simulations to really maximize that feeling of reality. And together, both of these sort of representations will form the simulation-based learning factor of this of the tutoring method, and then ITS will form that backbone for all these simulations to integrate together. So case study data collection, the motives and our plan. So in case study research, what we're ideally doing is we want to be able to quantitatively measure the causal factors of using existing simulated tutors in real-life phenomena. And what that means is we want to be able to look at the cause and effect of, using these different simulation-based tutoring methods and how effective they are. And in order to measure how effective they are, we're going to be looking at 3 specific metrics. One is going to be performance. And performance, we can look at what is the best way to measure this performance. So, for example, we might be using a learning curve that looks at experiences versus the level of expertise gathered from using a particular device over time. And the baseline proficiency would be measured from an expert point of view. Proficiency is the next one. And for proficiency, we'll be looking at maintaining an experimental and a control group. And in the experimental group, we look at different simulation tutors and how proficient how quickly the users will become proficient with those tutors versus the control group, which already has that level of proficiency established with using the specific procedure or the medical device. And the last one would be retainability. So looking at the performance level after a given time. So once we introduce the simulation tutor, and then give like a 10-day time period or a 20-day time period and introduce that a medical device to them, how retainable is their knowledge based off of their experience with the simulation tutor for that medical device in the past. So the idea behind this is we want to be able to find the best method that precisely measures learning ability through using simulation-based tutor. And the independent variable here would be the factor of content learned by using a simulation device, and dependent variable would be the efficiency of the content that is retrieved through the performance, proficiency, and retainability metrics. The design-based data collection, motives, and plans. So design-based research is going to cover basically a way to assess methods or curriculums that will optimize training and practices of simulation-based tutoring. So we want to be able to assess different curriculums and teaching techniques and kind of include that as part of this research project in order to have teaching techniques that will be very valuable for high transfer of skills. So the independent variable here would be the different curriculums. So there are multiple curriculums out there and curriculum structures out there. So we will look at that and then assess the usability of each of those curriculums with respect to medical devices. So that's the presentation for what work has been established so far in our project, and please provide feedback. Sorry for the long presentation, but I hope that this research going forward will, become very helpful for improving the knowledge and improving the expertise level of medical professionals